Again, I'm Dr. Wade Green,
I am Marcia Cummings.
and we are Illumin LLC. So today we wanted to talk about,
Well, what would you say? Just the variety of providers for mental health. Because
yes,
we get a lot of phone calls, and people may be looking for, sometimes they're looking for a male or female. Sometimes they want a social worker, or they would prefer a PhD level. They're looking for a licensed marriage family, or they're looking for a psychiatrist.
yeah, many times we get the phone call that they make an appointment with us, not realizing that we aren't psychiatrists, because that's what they were originally looking for.
Mm-hmm.
So it comes up later on, of course, usually before they actually meet with us, and I have to explain, no, we aren't psychiatrists. We don't dispense medication.
Right.
So this video today is actually to talk about kind of like the various titles and professional services in this field that you can seek. So,
And you hear a lot of initials, so don't become overwhelmed. You know, you can go online, you Google therapist, and you get a variety of initials. And I think sometimes that can be intimidating. So I want you not to get intimidated. But those initials all just let you know the level of schooling and training, because we are required to do so many hours before we can become fully licensed. So don't let that be a distractor. But let's break the list down.
okay.
I'll let you start us off with.
The first on the list is a psychiatrist. A psychiatrist is a medical doctor, and the psychiatrist mainly dispenses medication. Normally, when you make your appointment with a psychiatrist, maybe your first appointment might actually be an hour. Then usually all your appointments after that are for usually 15 minutes, maybe 15 to 20 minutes. And one of the things that people...
Oh, wait a minute. And in their defense, the shorter amount of time is because of insurance.
Yes, it is
Now, a
because
lot
of
of
insurance.
Right. Insurance does dictate the amount of time that they are able to provide, because there are some who won't take insurance only because they want to be able to provide more time. So I want to just put that little
Yes,
caveat out there.
In most cases, they get paid more for that 15 minutes than they will get seeing you for an hour.
Yep.
So, but that's usually, you're right, Marcia is right, is usually the dictation of insurance. And, but going back, psychiatrists are medical doctors. So, they actually went to medical school. Psychiatrist is a actual medical doctor. Hence, they can dispense medication.
And just like with any doctor who specializes in like family or internal medicine, they specialize in psychiatry. So that's the difference there. So then next on the list is nurse practitioner. So these are your registered nurses who, again, did a specialty in psychiatric medication.
Yes.
They are able to prescribe medication, and they also will some will enter private practice, or they will work under a psychiatrist or alongside a psychiatrist, one or the other. And they are able to prescribe medication. I don't think they provide counseling. I think they're strictly medication, right?
It's strictly medication.
Strictly medication. And a lot of times people like going to them because they're not as intimidated with the initials. And they do have that more humble nurse approach, I think.
Also, sometimes it's actually a little quicker to get an appointment with a nurse practitioner than the psychiatrist.
Very true.
As I usually see clients and they're trying to schedule with a psychiatrist, and I would tell them, expect your appointment a month from now.
Right. Whereas a nurse practitioner, you're looking at a couple, and sometimes several months.
Yes, could be several months.
And that's why you actually see a lot of psychiatrists bringing on nurse practitioners, because they can pick up the access. And a lot of nurse practitioners now are going into private practice because it's easier for them to just do it on their own. So
Yes.
we got that. So
Few of our clients
Yeah.
see a nurse practitioner.
right, that we like to refer to. So I think the next one is perfect for you, since this is what you are.
Well, not quite.
Well,
I'll explain.
he has the title.
The next one is a clinical psychologist. A clinical psychologist
Somebody's
is...
feeling a little cynical today.
A clinical psychologist is someone who has achieved a doctorate. It's either a PhD, which is a doctorate of philosophy, or a PsyD, which is a doctorate of clinical psychology. I actually have a PsyD. However, the difference is most clinical psychologists usually go for licensure. I did not go for licensure. but that's a story for another day.
Actually, a few don't go for licensure.
Yeah.
But often they've achieved their other titles. So they are a licensed professional counselor or LCSW, and we'll get to those. So a lot of times by the time they've gotten their PhD or they decide they're already doing the work, and so they will just usually kind of skip it and just say, let me stay on the path I'm on. So.
Yes. So that is a clinical psychologist. They have a doctorate degree, which is usually could be 3 to 5 more years of education. It all depends. Yes, a lot more money. Story for another day.
That might be a therapy session. All right, so next is the Licensed Clinical Social Worker, or LCSW. So, oftentimes everyone refers to anyone in this field as a social worker, but there is a slight difference. So their training is more on advocacy and policy and what's the other word?
There's case management.
Right, there you go.
And resources.
Right, that's what I was thinking, resources. And now, that doesn't mean it can't provide counseling, because most actually end up coming over to the counseling field and doing that approach. And a lot of the training is similar. We learn about a lot of their theoretical approaches. They learn about a lot of ours. And so, I mean, it's kind of, I always say it's kind of the same.
It is.
Like, the different, well, we'll get to that. Right, we'll get to that. And so, except they do push more of the advocacy. They're the ones that are going to work for your big agency, your human services and things like that. But like I said, when they do come over to the counseling side, which most do, is they do want to be more hands-on, providing support within the office. And I like to say that even though a lot of times we talk about advocacy, I'm full of resources just because of many of the jobs that I've had too. Mm-hmm. So I think even we kind of cross over in that field, because most of the jobs we end up having to get resources for the particular job. So, a lot of similarities there. And same amount of time in school, same amount of time.
They're still master's level.
Right,
so
licensure, to obtain licensure and training and things like that. And then we have the
licensed marriage family therapist. That's usually the LMFT. They are also a master's level therapist. The marriage and family therapist usually focuses on, I would say, interpersonal relationships. They deal with families, couples, marriages, premarital. But most of all, that is not totally their niche. They also see individuals. They can deal with depression, anxiety, just like the other master levels.
But their training and focus was on family systems. But as we know, the family affects the individual, and that's why they do a variety. So now I'm happy to discuss this one, because I think this is the best on our list. This is the most awesome.
Okay, we're partial.
Of course. Come on. They are the most awesomeness, the most amazing of all of these. Your LCPC, your LPCs, and your LMHC.
Licensed mental health counselor.
Or a licensed professional counselor, or a licensed clinical professional counselor, depending on the state. That's why you have all those different initials. And so these are individuals who are master level. They have done their 3,000 or 4,000 hours in training to obtain full licensure, and they are trained in a variety of systems, actually. So you're going to find your family and marital, you're going to find career, you're going to find a little bit of, like I said, a little bit of everything. And am I missing something? I'm missing something.
No. Well, one of the things we were going to discuss, kind of like the difference between an LCPC and an LCSW. One of those things is where the LCSW will learn more about case management and more policy things. Right. The counseling program focuses a great deal more on therapy.
Well, you know what? Honestly, they're all great, and they all offer great services. So it doesn't really matter which one you pick as far as going to counseling. If you do the marriage family therapist, if you do the clinical social worker, the LCPC, the psychologist, the nurse practitioner versus psychiatrist, it's about, what would you say there?
It's about a good fit. Mm-hmm. What works best for you personality-wise and relationship-wise with the person that you're working with. If you feel good about the connection that you have. That's the thing that matters.
Because we're not for every person. I know the fact that I'm very into mindfulness and meditation and energy healing. Everyone doesn't get that. Whereas I think you're very
Well,
on and
straightforward.
and mind you, I cuss in my sessions and I can be very blunt, and I don't always use a poker face. Sometimes, and I do that purposely. Most times, I need people to kind of know what I'm thinking and whatever they've shared. But not everybody's prepared for that, and so I mean, go with your gut feeling and what you're prepared for.
And what you're comfortable with.
There you go.
So, but thanks for watching, and we will see you later.
All right. Enjoy your day or evening.